Practitioners are often critical of research. Some argue that research fails to address questions of relevance to their day-to-day challenges, that research doesn't produce findings that they can readily apply, that research is too often incomprehensible. In general, that researchers are too far removed from the realities on the ground. This issue of how to produce research that matters to practitioners is one that business schools in particular have been grappling with. Last year, the AACSB, the Association to Advance Collegiate Schools of Business, released their vision for the future of business education. And one of the 5 pillars of their vision was to co-create knowledge with practitioners. So on this note, earlier this year, we received an insight grant from the Social Sciences and Humanities Research Council to undertake a study that we co-created with the input of over 150 practitioners. Why did we do it and how did we do it? That's the story I want to share. So at the time, I was an embedded researcher at Cancer Care Ontario, CCO, and the Ontario Renal Network, the ORN. CCO and the ORN are now units within Ontario Health, and they oversee and fund the delivery of cancer and renal services in the province. So my role as an embedded researcher was to conduct research through a collaborative process by working inside of CCO and the ORN, while also maintaining an affiliation with an academic institution. Now, we wanted to develop a program of research on health system performance management, which is one of the key functions of CCO and the ORN. We had some ideas in mind, we did a literature review, but we had one lingering question, and that was, how do we maximize impact on practice? Well, who better to speak to potential for impact on practice than practitioners themselves? So we undertook a stakeholder consultation process. We conducted semi-structured interviews with practitioners. We asked them about their experiences with the performance management system that CCO and the ORN use. We asked them for their burning questions about performance management. We asked them to assess and to rank research directions that we had derived from our literature review. We spoke with a wide range of practitioners. We spoke with leaders, staff, and clinicians from CCO and the ORN, leaders, staff, and clinicians from cancer and renal programs in hospitals across the province. We even spoke with a few policymakers, researchers, and even patients. We ultimately spoke with 156 individuals, and I can tell you we did not have that intention at the outset to talk to that many people. In qualitative research, we have this term, saturation. It refers to that point in data collection where you start to hear the same things over and over again, and you're not learning anything new. Well, we reached saturation and we kept going. Why? Because of the level of interest and enthusiasm among stakeholders to have this conversation. It was about more than the research to us. It was about stakeholder engagement, stakeholder ownership of the research agenda. I would even go so far as to say it was to promote a culture of performance and improvement in the system. In some ways, the research was kind of like an intervention that facilitated deeper reflection on performance and improvement. Now, are there challenges to undertaking a process like this, to co-creating a research agenda with practitioners? Absolutely. One that comes to mind for me is with regard to timeframes. Research can be a very slow enterprise. Qualitative research in particular, it takes a lot of time to collect qualitative data, to transcribe it, to code it, to analyze it. Meanwhile, practitioners are working under time pressures and really dynamic environments that are constantly shifting, particularly this year in the healthcare system. And they want insights as soon as possible, and understandably so. And so as researchers, we have to grapple with how to conduct research with rigor that is also relevant and timely. So the research that we co-created with input from practitioners will involve in-depth case studies with most improved and least improved programs on key performance indicators that CCO and the ORN are monitoring and managing. So we want to understand how and why some programs improved and not others. And to what extent did that have to do with the performance management tools and processes that CCO and the ORN are using at a provincial level? And to what extent did that have to do with other factors, organizational factors, environmental factors? So we're really looking forward to sharing our results in the near future and to continuing to have this conversation around how do we forge deeper forms of engagement between researchers and practitioners.